Welcome back to CTV Morning Live, and we have paged Dr. Paul joining us, the Medical Officer of Health for Eastern Ontario. Great to have you here. Always a different topic that we hit on, and looking at today's topic, we're looking at cancer prevention and screening. Those are the main keys today.
That's right. Well, you know, it's November, and we talk about men's health and men's cancers, and I think it's a good opportunity just to talk about cancer itself. We've gone a long way in terms of understanding cancer, being able to treat certain cancers, but I think the most important thing we've done is understand how we can screen and prevent it. So in terms of prevention, there are low-tech ways and high-tech ways, obviously, in terms of you know, going to see your doctor and getting a mammogram and those type of things. In terms of screening, what a screening test is basically trying to pick up cancer early. That's what screening is. So there's two different things here. Prevention is preventing in the first place. Screening is getting it early.
All right. In terms of screening, though, what are our options to?
Obviously, the best thing, depending on you know, man or woman, in terms of men, know your body, get your regular checkups. In terms of prostate cancer and testicular cancer as well. Young men are prone to testicular cancer, so you should be doing self-examinations. Know your body, see your doctor frequently, and for prostate as well, there are blood tests and there are other tests that you can do depending on your situation. So men who are over 40 should be thinking about their prostate health as well.
When you talk about blood tests, is this something that you would need to ask your doctor about rather than just on your annual visit? To it wouldn't be something that they would likely do.
No, they won't, because with the prostate antigen, it's PSA, it's called. It's a specific indication. In other words, certain men of age groups, and that's discussed on an individual basis. We don't do that across the board, but it depends on the specific age. But there are other symptoms, other tests your doctor can do, physical examinations that will assess the size of the prostate and so on. So that's the most important thing. In terms of the woman, obviously we recommend self-examination, and in older women, obviously, mammogram is quite important, and that's available now through the Ontario breast screening program in Ontario. So that's important as well, and get to know your body. The other thing that we say is right now, for the first time ever, talking about prevention, and I want to plug it a bit because I gave a talk the other day and people were surprised that we can actually now prevent specific types of cancers by vaccines. And cervical cancer, for example, is another screening that we do. So women get the Pap smear, right? The Pap test really looks at screening for early signs of cervical cancer. So before this vaccine, we would screen women, and if they had positive tests, they'd get treated and so on. Now, right now, we know that about 75% of these cancers are caused by a virus, the HPV virus. And that's new. That's kind of the first time we've
Is this are these the signs that I'm seeing, and it's for younger girls, so like age 13?
Exactly.
So that's what we're talking about.
Yes, it's called the human papillomavirus. It causes genital warts, and it's probably the cause of 3/4 of all cervical cancers in women. And so if you have a vaccine against that virus, and that virus causes cancer, you're preventing cancer. That's exciting. That's exciting breakthrough. So I think that we have a good future in front of us in terms of prevention.
Very quickly, in 10 seconds,
Sure.
Are people responding to this vaccine, or is there?
People are starting to get on board. We're offering it to the schools. It's free of charge in Ontario, and people are getting on board. The other thing, which is low tech but quite important, is exercise, eating right, not smoking and not drinking a lot. And those are really the things that you can do in terms of lifestyle. Because people say, well, you know, I watch my diet. It's good for weight, and it's good for, you know, losing weight and being trim. But the other thing too is vitamins and all the nutrients that you get in a well-balanced diet actually go a long way in preventing cancer as well.
Cancer screening, cancer prevention, really interesting topics. We could do an entire show based on these. You know, great that you have your own website, something that was new to the industry back when you designed it, drpaul.com. drpaul.com if you're looking at checking out the website and seeing all the information. And just something to think about, especially too if you have young girls getting towards that vaccine as well.